Hello everyone and welcome to our PEBC Pharmacy OSCE training for pharmacists. And another important case that is very popular in the OSCEs, which is the diaper rash case. Now I need you to pay very good attention to this case because it comes often in the OSCEs. There are a few things that a few tips that I'm going to give you today, and I'm actually going to play this case with an actress to show you how you're going to go through the questions quickly as you should, to avoid any delays and of course to solve the case within 7 minutes. And as usual, I'd like to bring to you some red flags, that things that when you see in the OSCEs, you should immediately know that this case will be a referral case. You should not recommend any over-the-counter drug for those patients. And there are quite a very few red flags. They all make sense for diaper rash. So as soon as you ask a patient or the actor or actress a few questions, you will immediately know if this is a red flag or not.
Hello. I need to buy a cream for rash, but not sure which one is best. Could you help me, please?
Of course. My name is Joe. I am the pharmacist, and I'd be happy to assist you today. Did you say you need a cream for a rash?
Yes.
Is it for yourself?
No, it's for my daughter.
I see. And where does she have the rash?
It's on her buttock area.
How old is your daughter?
She's 4 months old.
Okay, I just need to ask you a few questions before I can recommend something for her. Is that okay?
Of course.